Highly sensitive and highly specific enzymic sensor for early diagnosis of inflammation. Early diagnosis of inflammation, there is diagnosis before the appearance of clinical symptoms. This requires a sensitive and highly specific method that uniquely answers yes or no. The key stage of inflammation is the activation of white blood cells. Activated white blood cells produce a superoxide radical. Non-activated, not produced. But how we can detect this radical in vivo? Blood plasma contains nitric oxide donor compounds. There are various dinitrosyl iron complexes containing tyrol ligands. They have a very high chemical affinity for superoxide radical. The concentration of these complexes in plasma about several micromole. Therefore, these complexes do not have effective competitor for superoxide in plasma. As a result of the interaction, nitrite and other non-tyrolide nitroso compounds are produced. Normally, their total concentration in plasma no more of 50 nanomole. Leukocyte activation increases their concentration to several micromole. All nitroso compounds in the presence of chloride in plasmic concentration inhibit enzyme catalase with approximately equal efficiency. Plasma don't contain other substances that can effectively inhibit this enzyme. The mercury salt and iron chelator destroy nitric oxide donor compounds, and hemoglobin traps their last nitric oxide. This leads to the loss of the ability to inhibit the enzyme. But nitrite and non-tyrolide nitroso compounds not be destroyed by mercury salt and iron chelator action, and therefore they retain inhibitor ability in the system hemoglobin mercury salt and hemoglobin iron chelator. Content of a nitrite-like substance, we can this compounds call as a nitrite-like substance. Can be determined by the degree of catalase inhibition in the reaction medium after incubation of the sample in this system. No more than 1 milliliter of blood plasma is required for determination. If the nitrite-like substance concentration in plasma exceeds 150 nanomole, there is an ambiguous criterion for activation of white blood cells. Data obtained from more than 150 patients confirm this. There is not any case where clinical symptoms are not accompanied by increasing of nitrite-like substance in plasma. This indicator more sensitive and specific than erythrocyte sedimental reaction, number of leukocytes in milliliter, and content of the reactive protein. Nitrite-like substance appears before the onset of clinical signs and disappears in course of recurrence of the patients. There are the reagents that are needed to determine the nitrite-like substance. There are no expensive reagents among them. Determination of catalase activity is performed by registering the kinetic of hot production accompanying the decomposition of hydrogen peroxide. Therefore, there is no need to prepare and clean the sample from colored and turbid impurities. This device is capable to perform up to 20 analyses per hour. Its sensitivity up to 50 nanomole. This method is patented in Russia. Thank you.